Hi everybody and welcome. This is the European Health Management Association COVID webinar series. Today's subject is going to be on mental health in the midst of COVID. I'm George Valiotis. I'm the Executive Director here at the European Health Management Association. What we're going to do today is we have to mute everybody's microphones, and that's just to make sure that there's a clear channel. You can hear the speaker really clearly. If you want to ask questions, like I can see people are doing right now, you can click the chat box. You can tell us comments there, and at any point during the presentation today, you can type your questions in there, and we endeavour to answer all of the questions. So type away into the chat box, and we do record these webinars as well. So if you're interested in any of the previous webinars, the first 5, you can log on to that website there and check out our YouTube account where they're all listed. And this one will also be added there. So today's agenda is looking at the impact on mental health services. We're looking at key opportunities and challenges for mental health and services in the aftermath of COVID-19. And then once we've had the presentation, we will go to a Q&A with you guys, the audience. It'll be about a 15-minute presentation from Marcin Rodzinka, who we have the pleasure of him joining us as the Advocacy and Policy Officer at Mental Health Europe. Thank you so much, Marcin, for joining us today. I'm going to hand over to you now for your 15-minute presentation. Many thanks.
Thank you very much. I hope you can hear me well. I have a feeling that I fill in the gap a little bit of Eastern Europe, Central Eastern Europe, as I'm originally from Poland, but I'm based and I'm working in Brussels for Mental Health Europe, and I'm Advocacy and Policy Officer for this organization. And I'm very happy to be here today with you, and thank you once again for the invitation. I will try to be brief and stick to my 15 minutes. And my plan for today is to give you a little bit of a very short introduction to who we are as Mental Health Europe, and then indeed go through the points about impact on mental health of the current pandemic, and then impact on mental health services, more specifically in Europe, in a couple of countries. We'll go through a couple of specific considerations that are quite important from our perspective when we discuss mental health in the light of COVID-19. A couple of opportunities and challenges and lessons learned from COVID-19, and how this can impact future design and shape of mental health and services in Europe. And then we'll end up with some recommendations, with conclusions with some recommendations that are built on both work of Mental Health Europe and United Nations. I hope it will be practical enough for you. Feel free to ask any questions, and there we go. So Mental Health Europe is a non-governmental network organization. We have more than 70 members from 30 countries. And we gather in our membership users of mental health services, but also professionals, also researchers, also service providers, academics working on different aspects of mental health, and also family members and carers of people with mental health problems. And our objectives are to promote positive mental health, fight stigma, and advocate for the recovery-based models of mental health. So we are quite old. We are 30 years old. We work across the European continent, and we have 5 strategic priorities. We work a lot with European institutions and international bodies. We are a policy-oriented organization, so we work more as a knowledge provider, policy advocates, and also a network for people working in mental health. So we work a lot with policy recommendations. What's important for us, and I'm going to try to highlight this as well during my presentation, is a place of users of mental health services at the center of our work. We are not a patient organization. Our membership is very diverse in a sense of actors interested in mental health, but we have a high representation of the users of mental health services. Also, just a disclaimer, we are independent from any industrial funding. We have funding also only for the European Commission and Open Society Foundations. Here below you can find logos of the key collaborators of Mental Health Europe. So indeed work with the key institutions. Our priorities are promoting psychosocial model of mental health, and what that means in practice. I'm gonna talk a little bit about this during my presentation. Again, involving users of mental health services in decision-making processes at any level, be it national, European, international, or very, very local. And we are focusing very much on recovery-based community mental health services, and this will be a substantial portion of my presentation. So we can move on now to the core content of the presentation. So as mentioned, I would like to start with talking a little bit to you about the impact on mental health. We already have some data on the impact of COVID-19 on mental health in Europe. Those are not well advanced data. They're coming from a couple of countries, but all I managed to gather, probably that's not everything that's available, but it already gives us a glimpse of the situation that we are facing at the moment. So just to start off, I want to say that mental health was already in a worrying situation and position before the pandemic, and the pandemic only exacerbated the mental health problems in Europe. So before COVID-19 came into picture, every 6th adult in the EU had mental health problems. We call it also mental ill health. So that's around 84 million people. And mental ill health, it's simply a reason good enough to affect the way we work, the way we live. That also comes at a cost. So the economic impact of poor mental health in Europe at the moment is estimated to reach 4% of EU GDP, costs related to lost productivity and social costs. And I want to start with citing the words of Dr. Tedros again, that the impact of the pandemic on people's mental health is already extremely concerning. And that was said in May 2020, when the UN issued a report with some recommendations and analysis of the situation when it comes to mental health in the light of COVID-19. And according to him, and we fully agree as Mental Health Europe, what's the main concern for this pandemic and its impact on mental health. Those are things like social isolation, fear of contagion, loss of family members due to the COVID-19. That's all. This is compounded by the fear of losing income and being unemployed due to the huge impact of COVID-19 also on economy and in general. So, but it's also clear that this pandemic hit mostly people that are in the most vulnerable situations. So of course, people with pre-existing mental ill health were hit hard by the pandemic, both by the stress related, but also by the disturbances in the mental health services provisions, but also people that were considering themselves or are considered as as healthy or living without any mental health problems were also affected by the pandemic. So Lancet Commission in 2018 said that mental health problems exist along the continuum from mild, time-limited distress to severe mental health problems. And what COVID-19 showed is that it kind of replaced all of us on this continuum. So people with pre-existing conditions were severely affected, but also people who previously coped well might be now less able to cope because of the multiple stressors around. Just one point before moving on is that mental health, we already see a great impact on mental health in the current context. It's quite recent and it's happening at the moment. But what will most likely happen is that the impact and the hidden costs and consequences of the pandemic will be played out in the years and decades to come, and it only will exacerbate the current inequalities due to the huge impact of the COVID-19 on social and economic life. So this is likely to be a major problem in the coming years. And now moving on to more specific information about the countries in Europe that already did some research on the scale of the impact of COVID-19 on mental health of its citizens. So starting with Belgium, already we know in Belgium, thanks to the research of the Public Health Institute Cienzano, that mental health problems sharply increased, and that was mainly checked when it comes to depression from 10% in 2018 to a current rate of 16%, and the most affected group was a group of young people, both male and female, between 16 and 24 years old. Belgium is redoing the survey, so we are likely to have more information in the weeks to come. When it comes to the UK, again, the National Office of National Statistics made research which found out that 25 million people in the UK experienced high level of anxiety in late March. So that was very targeted check. And the survey found that increased levels of anxiety mainly stemmed from such an obvious reasons as concerns for personal well-being, job security, and the impact of COVID-19 on their finances. So that's, again, that shows that people are concerned very much about the impact of the COVID-19 on their lives. In France, 18% of teleworkers experienced mental health problems such as severe anxiety, depression, and other. It was primarily women, so that also shows the gender aspect of this impact. In Italy, in one of the countries that was the most affected, especially at the early stages, there was increased prevalence of anxiety, depression, and insomnia. 37% of respondents of the study conducted by University of Rome said that they had post-traumatic stress symptoms, depressive symptoms, 17%, 20% severe anxiety, insomnia, and stress. So that shows the situation in a couple of countries in Europe. Now moving on to the impact on mental health services and on the delivery of services more than on the services itself. So due to the COVID-19, both outpatient and inpatient mental health services have been severely affected due to a lot of reasons, mainly closures, limitations in functioning, but also mental health of the staff working in the institutions, both in the community setting, but also in the institutions delivering mental health services in a more traditional way. There is also visible demand, decreasing demand for face-to-face mental health services, but that's only a demand for the services. The needs are there, and they are even more common than before the pandemic. Due to the limitation and isolation, lockdowns in all the countries, almost all the countries, we saw increased focus as well on digital self-help and digital mental health services, meaning that a lot of services that used to be provided in a face-to-face setting, some of them were transferred to the digital world, and they were continued, but in a very limited scope. And of course, digital solutions have great potential, and I'm going to formulate one recommendation based on this. But there are also huge limitations when it comes to digital solutions and use of digital tools in delivering health services, especially mental health services. And that's something that we learned from our members working in a couple of European countries, for example, Netherlands, Germany, Scotland, that limitations of limited access to internet, but simply limited literacy with digital tools. That was all well visible, and also that became clear that not all digital solutions are suited for all mental health needs. So there's not everything can be replaced in this context. I want to talk to you again about a couple of countries that we have information from. And those would be mainly about the institutions in France and Spain. That both faced huge, that we know that there were a lot of problems in mental health institutions dealing with mental health. Example from Spain is quite positive because it showed how services adapted. So mental health beds, so-called, were used to accommodate patients with COVID-19, but then Spanish authorities at the very local level found a way to accommodate the needs of mental health patients and users to continue delivering needs to them. In France, we saw, due to the lockdown, a lot of ill treatment in mental health institutions. So that shows as well the impact on people with pre-existing mental health conditions in the institutions, and the exposure to the COVID-19 that was higher compared to the general population. And maybe just moving on, I can mention that in Belgium there was almost all face-to-face services were cancelled. In the Netherlands, 60% of mental health services users reported partial or entire suspension of their treatment, which is a huge number, and 80% couldn't access daily care. And interesting thing is that what we learned after this couple of months, that the mental health services delivered at the community level have of course also been critically impacted, but appeared to be more flexible in a sense in the delivery than the big long-term institutions that are delivering mental health care in a very traditional way. And those services that are delivered within and by the community appeared to be more flexible and accommodative in a sense of continuing delivering services to people in need. The three main points that I would like to draw your attention to that are linked to the pandemic and to mental health is that we started seeing at some point importance of mental health of the staff working in healthcare, especially those at the front line. And there are some data from Spain saying that 1,200 medics questioned by the university in Madrid had depressive symptoms, and 53% show signs compatible with post-traumatic stress. And that's something that needs to be also addressed quite quickly in the light of the pandemic. There's also something that I mentioned is the incomparable impact on people with mental ill health due to the pandemic, both because of the limitations in the delivering of the services, but also due to the current stigma, discrimination, but mainly conditions in the institutions and lack of services. And also people on impact on people in vulnerable situations. Something that came to our attention was that someone said that the best protection against COVID-19 was staying at home, but there's also a lot of people in the vulnerable situations, such as homeless people, that have nowhere to go, and they're also heavily exposed to the COVID-19 infection. So now I know that I said I'm going to be done in 15 minutes, but just to say a couple of conclusions with recommendations. So what we as Mental Health Europe think that is important to keep in mind while thinking about mental health and services for the future, and also it's shared by the United Nations, is that health systems alone are really not enough to address the mental health challenge of the time. We need better integration with social services and social support. And just one slide before. And the lesson learned for us, that is the greatest lesson learned, and I think that's something that was recognized already by a lot of people, but now came to the attention and is recognized even more, is the strength and importance of social factors and economic factors on mental health. Because what's happening now at the moment, mental health is not affected by the COVID-19, it's affected by all things that are caused by the COVID-19. And all this can really help us understand better how we can better design our services to be better prepared for the future crisis, but not only for the crisis, but in general, being better prepared to address mental health needs of the European societies, taking into account the wide spectrum of factors that we know, and now it's even clearer, that impact mental health. And moving to the final slide, with conclusions and recommendations, a couple of points. So again, what became clear is that we need more collaboration between sectors. There were already a couple of positive examples from the UK of healthcare services, social services, even police addressing mental health impact of the pandemic. And we need more of this. We need more integration and better integration of social and health. And that links very well to the psychosocial model of mental health, which is a model that, in the opposition to the biomedical model, looks not only on the biological factors of mental health, but looks also at the psychosocial and economic risks for mental health. So this is a momentum really to, when we think about changes in our services, to really advance on community-based services. That's really the momentum, because there's a great interest. This webinar is a proof of it in mental health. Like, everyone sees the problem, everyone wants to talk about it. We need to really seize the moment and use this in planning our services for the future, and putting more resources, more attention, and more recognition into community-based best services that proves to be the most effective way to keep going with the support during this time, during this challenging time. And I'm just checking my time. Mental health literacy and stigma, it's also crucial, and that was something that Mental Health Europe wants to stress a lot, and UN as well, that experiencing distress in the current setting and in general, it's a normal reaction to different situations that we found ourselves in. There's just, I think, to know that there shouldn't be any problem with reaching out for support, but also we should recognize that it's not fully about us and our biological dysfunctions. It's mostly about the environment that we live in, and also that will determine the answers, treatment, and the future design of the services. And again, exploring digital solutions, it's crucial, I think, at the moment, but keeping in mind that mental health mental health support can be delivered remotely, but there's a lot of I don't want to use this word, but conditions or disorders or different needs of people that cannot be dealt with in a digital setting. So I think we also should avoid this hype for digital, because of course it's useful and it can increase access to services for a lot of people, but it's not a solution to all the needs. And final point, and I think this is the most important thing for everyone, whoever works with the planning of services, delivering services, thinking about the high policy priorities for the national mental health services delivery. It's involved people with lived experience and people that are concerned about mental health, but mainly people with lived experience in the design, implementation, and monitoring of services, because that's the lesson learned from the current pandemic, that those services that were the most agile in a sense were those that were co-designed and co-delivered with and by people with lived experience. And there's a lot of innovation that we can implement in the aftermath of COVID-19, but again, keeping in mind the psychosocial model of mental health and recognition of the really important and strong factors that are influencing our mental health. And I think I will just wrap up here to give enough time still for the questions. I'm happy to answer all of them. And I hope you found it at least partially useful for yourself.
Oh, it was more than partially useful. It was very useful, Marcin. Thank you so much. That was absolutely fascinating. We've got some comments already that speak to that. So Lucia says, hi, super interesting information. I was wondering if you could share the links to some of the studies you mentioned, like the one from Spain. So your presentation will be put onto our website, and there will be links for people to be able to find your organization, and we will also put up the links to the studies. If we can get them from you, Marcin, then we'll put them all up there. So that'll be, so my colleague Chiara, who probably might have emailed a lot of you, will send you a follow-up email to everyone who's logged in right now, and there'll be all the links, all of that information. Eric Machuki says something similar. Good information herein and superb info. Is it possible to get this presentation and the referred studies? So yep, that will be online. Thanks from Lucia. Ellie Breedveld says, great presentation, thanks. If there was money, where should we invest it? What would be the priorities?
Again, I think community-based services, again, there's a lot of missed opportunities in the way that we use our resources that are available for mental health services, both at the European and national level. I think there's enough money. It's just that it takes time and the change of approach to mental health, and the way we want to really think about it and address the needs of people. So I would say we should really stop spending money on improvement of the institutions, and rather working with people on the ground, and learning also from the good examples of whole countries really that are well advanced in delivering services in the community, like the Netherlands, for example. And we have feedback from our members from there. Just to give you a nice example, like very live example from a couple of weeks ago. When the institutions were locked, when the institutions were closed, and when the people with mental health problems very often were staying locked in the institutions without any contact with their families, in a very poor conditions, both sanitary and mentally and health-wise. Services delivered by people with experience and services services differently designed were able to continue. For example, our members from Utrecht, they introduced something that was a coffee to go, and for example, people that like mental health staff we're still following up with people that were taken care of by the services, and we're still able to check up outside, more on the individual level, or like be innovative in a way, like, okay, maybe we cannot have a consultation face to face, but we can have a bike ride. It's not always possible, but it's always easier to find people in their own and natural environments and adjust this with more options available to the real needs of people. So again, I think it really asks for a change in thinking about mental health and about investments, because there are money available, and the EU is great actually in advancing on the community-based services, and hopefully future MFF will be also a useful tool for that. Under one condition: we should really stop investing in development of the institutions, because that's not the way to go, simply.
Okay, that's an interesting point. Thank you, Marcin. You have a comment from Todorka Konstantinova, who says many thanks for the useful presentation. And Ellie agrees with your response to what you've just given to her question. I've also just put up a link for everybody, which is, it's a 90-second evaluation of how this session went. So if you want to give Marcin any feedback about the presentation, please do spend 90 seconds filling that out. And if you have any ideas for us on how to keep improving this series of presentations for you. Francesco Di Rosa has a question for you, and we've got time for a couple more questions. So Francesco's question is, do you think that cooperation with local police to have data on worse situations could help in your studies and actions, and cooperation with psychology students like in the Dutch recent model? Thank you so much.
Definitely. I think a cooperation between the different sectors. So again, I mean, for us as Mental Health Europe, again, it's not something that we as the organization, because we're more like an umbrella network, but I'm pretty sure that for our members working on the ground, that are working with people in vulnerable situations, that are very often coming from the private areas, from areas that are facing a lot of problems in terms of socioeconomic factors and a lot of challenges as well. Collaborating with services such as police or social workers can really bring added value, both in data available, because then we know what's happening on the ground, what should be addressed. But again, we shouldn't be only thinking about the results of, for example, if there is a high criminality in certain areas, there's always a reason for that. It's like with mental health. Mental health can be poor, but there's always a reason for that. That can be found and tackled. So it's more important to find a reason for the problems. And my point here is that it's both useful in terms of data, but also useful in terms of collaboration between different sectors, because only then we can have a full picture of the needs of people living in the certain areas or certain places. And psychology students, I think it's. I think personally, but also as Mental Health Europe, we think that there's a great potential in the future generations of healthcare professionals, both doctors, students, and people working in mental health sector. Again, a wide spectrum: peer workers, people with lived experience, social workers, but also psychologists, in educating future generations in a sense, and raising awareness on, I don't say that, but I think I'm going to say that, on the right approach to mental health, really. That is a true answer to the problem. Yeah, and I think if you are interested, we can definitely put you in touch, for example, with that members, actually, because we have more than one in the Netherlands, and you could explore the potential for cooperation at the national level.
Okay, terrific. So we've got time for probably one more question. I have a question for you, Marcin. But just before I ask that question, I'll remind people, if you could please fill out the evaluation. This session here that we're doing on mental health came about as a result of a large number of people who, in response to the evaluation, told us that they'd like mental health to be a future topic. So in that 90-second evaluation, if you've got any ideas, if you want to hear more about mental health, let us know in that evaluation. If you want to hear more specific things on mental health or any other topic, that's the place to let us know. It's also your way to give some feedback to Marcin about what you enjoyed about his presentation. So my question is, what about people getting unwell with COVID who are living with a mental health condition? Have you come across anything about how health systems could better address the unwellness of COVID unwellness in people with mental health conditions?
I think the key here is information as well. I mean, it's information about a lot of things. It's information about mental health. It's information about the impact. It's information about those things that people are the most fearful about. So the possibility of getting infected, possibility of losing someone. First thing is to take care of people in a sense of knowing what's going on with them, trying to maintain the continuity of the support and services. And I think what we can learn from the current context is that maybe it would be good to extend the scope of services on the more social aspect. So, for example, if we are a health facility, for example, providing consultations to people in our area, maybe, of course, if that's possible, in the ideal picture, it would be, to make a link between the social support that people might need in the current context, and ensure that people are taken care of from different angles that are needed. Yeah, that would be my answer, I think.
Okay, great. Well, unless there's any final questions, we'll wrap it up here. You also have a thank you from Maria Jevtik. And I'll just take this chance to thank everybody who's joined us today. Once again, if you haven't yet filled out the survey that I've just posted, please do that. I can see the responses coming in on my screen, and there's a number of you responded, so thank you so much for that. If these webinars came about because our members asked us to give them immediate practical information to help improve the European response to COVID. And so we've been running these every other week to do that. So thank you to our members for helping us shape this. If you're not a member, please do join us. You can come to our conference as well, which is in November 17, 18, 19, focusing on Rotterdam, but held digitally, and looking at all of Europe. Our next webinar on this series will be procurement, and using procurement as a tool of innovation to make sure that we have the right equipment to respond to COVID-19. So join us on June the 30th at 20 for that. And once again, EHMA just would like to thank all of our people, everyone who's logged in. If you're logged in right now, it means you are part of a good European response to COVID. Thank you for your great work. Thank you for your outstanding presentation today. It was truly fascinating. It'll be up on our website. And thanks to everyone. Do take care. And if you want any other information from us, there's our social media information, Twitter, Facebook, and YouTube, where we post these videos. Take care, everyone, and bye for now.
Thank you very much.